Welcome to the 2025 Medicare Basics. This is our three-part recorded series. The first part is on enrollment periods. This presentation is given to you by the State Health Insurance Program, Medicare Counseling Program. We are members of the Boulder County Area Agency on Aging and also Senior Medicare Patrol trained in the prevention of fraud. You can reach us by calling 303-441-1546 or send us an email at medicarecounseling@bouldercounty.gov. Ready? This slide will show you how through these presentations, what the three parts cover. In part one, we're going to cover what is Medicare, the enrollment periods, who enrolls, when, and how. What is Medicare? Medicare is a federal health insurance program that began in 1965. It was part of the Lyndon Johnson administration, the Great Society, and it was meant to help those people that were retiring at age 65 and didn't have any option for health coverage. So it's for people that are 65 years of age or older, anybody who is under the age of 65 but has been receiving Social Security disability income for 24 months. In the 25th month, they would become eligible for Medicare and be automatically enrolled. Anyone with end-stage renal disease or ALS, known as Lou Gehrig's disease, you must be a U.S. citizen or a legal permanent resident to enroll in Medicare. Medicare is administered by the Centers for Medicare and Medicaid Services, CMS, and it's portable. You can use it anywhere in the United States. So if you're getting tons of mail, which you probably are if you're approaching the age of 65, you'll be looking for any envelopes that are coming from Social Security or from CMS. Most everything else will probably be advertisements or companies that are trying to get you to enroll with them. Your journey with Medicare is going to start with your enrollment into Medicare Part A and B. Enrollment and eligibility is done through Social Security. So you have to go to Social Security to enroll in Medicare Part A and B. Part A is going to be your hospital insurance, that's inpatient, and B is your medical insurance. Once you have Medicare Part A and B, then you're going to make some choices about how you want to receive your coverage. Part C, those are Medicare Advantage plans. They're provided by private insurance companies that contract with Medicare, and they cover your Part A and B benefits, and most of them include drug coverage. They do offer some extra benefits. That's going to be what you see advertised on television a lot, and we have a lot of plans to choose from in Boulder County. Part D is the Medicare prescription drug coverage. That's provided by a private insurance company that contracts with Medicare, and it would cover the prescriptions that you pick up at the pharmacy and that you take at home. So anything you're picking up at like CVS or Walgreens or King Soopers, you're taking them at the home, that would be a standalone prescription drug coverage or a Part D plan through a Medicare Advantage plan. Okay, the basic principle of enrollment is that you must enroll in Medicare when you turn 65, unless, and you'll see we have that there in red, unless you or your spouse is an active employee covered under a large group health plan. Large group health plan is defined by a company that has 20 or more employees. So if you're actively employed, covered under a large group health plan, you do not need to enroll in Medicare. If there are fewer than 20 employees or you're self-employed or you're retired, you must enroll in Medicare at 65. So what happens if you made a mistake and you don't enroll in Medicare when you should have enrolled? If you don't sign up for Part B when you're first eligible, you may have to pay a late penalty for as long as you have Part B. This is a big deal. The penalty is pretty steep. So for every 12-month period you go without having Part B when you should have signed up for Part B, there is a 10% penalty. They add that on to the Part B premium. And once you have a penalty, you have a penalty for the rest of your life, or as long as you have Medicare, which for most people is the rest of their life. A special enrollment period usually exempts you from this penalty. We have to say usually because we're government, but if you're employed and you have creditable coverage, more than 20 employees, you will have a special enrollment period to enroll in Medicare when you leave that employment. So we give you an example here of what the penalty looks like. The Part B premium is $185 per month this year in 2025. We give you an example of somebody who's enrolling 2 years late, a full 24 months. And we're going to times 185 by 2, then by 10%. And while your neighbors are going to be paying $185 a month for their Part B premium, you're going to be paying over $200 a month for your Part B. Again, once you have that penalty, it stays with you for life. You'll pay it every month for as long as you have Medicare. So we want to make sure that you understand when you should enroll, how you should enroll, what's appropriate for you to avoid this penalty. We do see people every year that are subject to a penalty because they didn't enroll when they should have. So any questions, please give us a call at 303-441-1546. If you're just turning 65 and you've been receiving your Social Security benefits or took your benefits prior to turning 65, like say you took it at 62 or 63, you're going to be automatically enrolled into Medicare Parts A and B. You will receive that packet with your Medicare card about 3 to 4 months before your 65th birthday month. You can also be automatically enrolled into Medicare Parts A and B if you have been receiving Social Security disability for 24 months under the age of 65, or you have ALS or end-stage renal disease. Now, you can decline Part B. We'd like you to call us first if you're thinking about declining Part B, just to make sure that that is the appropriate thing for you to be doing. But if you are working and you have creditable coverage through your employment, then you can decline Part B and you'll have a special enrollment period to enroll when you leave work. Coverage with Medicare always starts on the first of the month in which you turn 65. And if you're receiving your Social Security benefits, that Part B premium is going to be automatically deducted from your benefit each month before it's deposited. And then just a reminder that Part C and D, those are not automatic. You have to be proactive and choose one of those plans and enroll. Now, if you're not receiving Social Security disability or your Social Security income prior to 65, you're going to have to apply for Medicare. So if you're applying for Medicare Part A and B because you're not receiving your Social Security benefit prior to 65, then you have to do it during one of the enrollment periods. There are 3 enrollment periods. We're going to go through each one of these in detail coming up. The initial enrollment period, that's going to be around your 65th birthday. Special enrollment period will be for anybody continuing to work past 65. And general enrollment period is for anybody who missed the initial or the special. Now, there is a note here that we like to make people aware of, is that if you're going to be enrolling into Medicare but not taking your Social Security benefits, there are a lot of us that want to wait till our full retirement age to maximize our Social Security benefit. So we may enroll in Medicare at 65 and delay our benefits until 67 or later. If that is the case, then Social Security is going to bill you, and they bill you 1 quarter in advance. So we've seen people get bills, their first bill anyway, for up to 5 or 6 months. It's going to be really dependent on where your birthday lands when you're enrolling. If your birthday's in February and your Medicare is going to start February 1st, it's likely you would be billed for February, March, to catch you up to the quarter, and then April, May, June, the following quarter. And that's how you can get a 5-month bill. It can be a little bit of a shock because 185 times 5, you're looking at a good chunk of change there. And people are often surprised. So we just want you to be aware that that is coming. It happens frequently. There are ways to set up automatic deduction from your bank account. It's called Easy Pay, and that application is done through Social Security. So how do you actually enroll into Medicare Parts A and B? Easiest way is to do it online at the ssa.gov website. The website is right here on the slide. It's ssa.gov/benefits/Medicare. It does require that you have an ssa.gov account to complete the application for Medicare. So I would suggest that you, if you don't already have an account, that you create one now, because they do ask you some questions in order to identify you or make sure that you are the person you say you are in creating that account. If you get any of those answers wrong, they will mail you a code, but that code takes about 10 to 15 days to arrive at your home in order to finish your application. So creating one now will save you the angst later in completing that application. The application is pretty easy to do online, especially if you are enrolling at 65 during your initial enrollment period and don't have to add any documentation of work coverage if you're enrolling over the age of 65. You can call the local Louisville Social Security office. That number is 1-877-405-5872. They are open 9 to 4 Monday through Friday. We've been told recently that it is kind of a lengthy wait time when calling. They don't take walk-ins right now. Haven't for several months. So you have to, if you need an appointment, you have to call in order to get an appointment. There is also a national line that you can call, and that's the 1-800-772-1213. They are open a little bit longer, 7 a.m. to 7 p.m. And if you wait a little bit later in the day, then all of the East Coast hours have, they've passed that 7 o'clock time slot, and so you'll have a little bit quicker time trying to get through. So this is what the screen looks like. When you go to that ssa.gov website, you will see this page, and you're going to click on this blue button that says sign up for Medicare. When you click on that button, it's going to take you to the following page. So here on this page, you're going to have two options. The top box there where it says apply online or sign up for Medicare. This is for anybody who's 65 years or older, enrolling in Medicare Parts A and B, or Part A only. You can also apply for your retirement benefits here if you want, or only Medicare. The bottom box is for people that are signing up for Part B only. So this was somebody that maybe took their Part A benefit at 65 and now they are 70, they're leaving work and they're getting ready to enroll into Medicare Part B. You would use that Get Started button on the bottom, and as a part of your application, they will require that you submit documentation that you had coverage from 65 forward. Okay, now we're going to take a deep dive into the enrollment periods. We're going to go through each one in a little bit of detail. These are the three enrollment periods: your initial enrollment period, special enrollment period, and general enrollment period. The initial enrollment period is a 7-month time period that surrounds your 65th birthday. We have kind of filled this out a little bit to give you an example of how it works. So if you'll see here that we're using the example of having a 65th birthday in June. So if my birthday were June 15th, I would enter June here. If your birthday's September or May, put your birthday month in there. And then what we're going to do is we're going to count backwards 3 months. So in this example, May, April, and March. My initial enrollment period, if my birthday was in June, would begin in March. If I enroll in March, April, or May, my Medicare coverage is going to start June 1st. If I don't enroll until June, my Medicare coverage would start July. You'll see how these yellow boxes go forward. I'm not late still. I could enroll in July, August, or September, and I'm not at a risk for penalty, but the month that I enroll is going to determine the month that my Medicare coverage will start. So if I don't enroll until September of my initial enrollment period, my coverage is not going to start until October 1st. So you have a full 7 months to get enrolled into Medicare Part A and B with no risk of penalty. If your birthday is on the first day of the month, so if my birthday were June 1st, this entire chart is going to back up 1 month. My initial enrollment period in that example would begin in February. It'd be February, March, April. My coverage would start May 1st if I had a June 1 birthday. That can get a little bit confusing. So if there's anybody out there that has a birthday on the first of the month, call us and we'll go through your initial enrollment period in detail with you so you know when to enroll. Should you take Medicare Part A at 65? Some people do, and it is appropriate for some and not for others. So if you are continuing to work and you're employed by a large group health plan, which is more than 20 employees, or your spouse is working and you're covered through your spouse's active employment, then you don't have to enroll in Part A. You can, and it may enhance some of your inpatient hospitalization benefits through your employer plan, but we would have you check with your benefits administrator to see if that's appropriate for you or if it would enhance your benefits. You don't have to enroll in Part A though. No matter what your sisters, cousins, uncles, plumber says, we hear from people all the time, oh, my neighbor said, or my neighbor's sister said that I had to enroll in Medicare Part A at 65 or I'd have penalties. If you have creditable coverage, you're actively employed or your spouse is actively employed, you do not have to enroll in Medicare at 65 or Part A. Now, a lot of people do take it at 65 because there's no premium associated with Part A if you have the right number of quarters of work history. One reason to delay enrollment into Part A would be if you are in a high deductible health plan that is paired with a health savings account and you want to keep contributing to that HSA. So I've got active coverage through Boulder County. I have a high deductible health plan. I am contributing to an HSA. I'm going to delay any enrollment into Medicare at 65 because I want to keep contributing to that HSA and I want to build it up. So if you're going to enroll in Medicare, any part of Medicare, or take your Social Security benefit, you have to stop those contributions in the HSA. And we're going to talk about that a little bit more on the next slide. If you enroll in Medicare Part A and or B, you can no longer contribute pre-tax dollars to an HSA. Medicare is not a high deductible health plan. This is an IRS rule, so you can, if you have an HSA, you can use it. You just can't have any part of Medicare and continue contributing to an HSA. What you want to keep in mind here is that if you're older than 65, so say I am 70 years old and I know I'm going to be retiring at 70, and I want to contribute to my HSA up until 70, then I am going to stop my contributions at 69 years of age in 6 months. The reason for that is that when you enroll in Medicare over the age of 65, your Part A benefit of Medicare is going to be retroactive up to 6 months. So if I'm enrolling in Medicare at 65 and 4 months, my retroactive period would be only 4 months. It's going to be up to 6 months. If you're enrolling at 67, then you want to stop those contributions at 66.6 months. If you have additional questions or concerns about this, you should talk with your tax professional or your HSA bank. HSA banks deal with this all the time, and they will let you know exactly what you need to do, if anything, enrolling in Medicare and contributing to an HSA. You also want to keep in mind that claiming your Social Security benefits over the age of 65 is going to automatically enroll you into Part A, and that Part A benefit will be retroactive for 6 months. So this is another way that people sometimes get caught contributing to an HSA. They decide to take their Social Security benefits and are retroactively enrolled into Medicare Part A coverage. Just keep that in mind. So applying for Medicare Part A or B or claiming your benefits will trigger that retroactive coverage over the age of 65. Do you want to enroll in Part B during your initial enrollment period? Well, this is going to be anybody who is in one of these categories. If you're not working, if you're self-employed, if you are on a COBRA plan, that catches a lot of people, if you're receiving retiree health benefits, or anybody that's employed by a company has fewer than 20 employees. You will want to enroll in Part B during your initial enrollment period. So enrolling in Part D, if you're going to enroll in A and B, you should enroll in a Part D plan during your initial enrollment period as well. Some COBRA and retiree plans do have creditable Part D plans, but there's a couple different ways that you can receive your Part D benefit, either through a standalone prescription drug plan that you're coupling with your original Medicare, or by enrolling in a Medicare Advantage plan that includes drug coverage. There are penalties for not enrolling into Part D when you should have enrolled. They're not as steep as the Part B penalties, but once you have them for life. So why have a penalty at any point in time? We just like to see people avoid that if they can. And there are great options for Part D plans that won't cost you anything at this point in time anyway. So yeah, if you ever want drug coverage now or in the future, the time to do it is to enroll during your initial enrollment period. Okay, so the special enrollment period, your SEP, this is for everybody that is planning to continue working after the age of 65, which is a lot of us. A lot of us are trying to reach our full retirement age. So if you can say yes to question number one, uh, will you or your spouse remain an active employee in a large group health plan, 20 plus employees? If you can say yes to that, you do not need to enroll into Medicare Part A or B, no matter what anybody tells you. Give us a call if you have any questions about that, but this is what the special enrollment period is for. It's for people that are continuing to work past the age of 65. You won't have any late enrollment penalty as long as you have continuous creditable coverage. So we added this word continuous because we did get caught once. We had a person who they lost their job at 66. They were on COBRA for a year. They were reemployed at 67 and worked until 70. When she went to enroll in Medicare, had she had continuous coverage? She had not. So she was looking at paying a year penalty because she had a gap in coverage that was longer than 12 months where she didn't have creditable coverage. So when you're leaving employment, you have 8 months from the loss of your employment to get enrolled into Medicare Part A and B with no risk of penalty. We don't like to see people wait that 8 months because things happen, people forget, time passes quickly, and it also takes Social Security a little bit of time to process your application once you do apply and assign you with a Medicare number. So don't wait that full 8 months, just get her done. Any questions on that, give us a call. If you couldn't say yes to question number one, if your answer is no and you're in a small group health plan or you're self-employed 1099 employee, you must enroll in Part A and B or you will be at a risk for penalties. Best time to enroll in Medicare to avoid any late enrollment penalties is either during your initial or your special enrollment period. And then, of course, to avoid gaps in coverage, we like to see people sign up before their current coverage ends. So if you know that your retirement date is the end of May 31st, you're leaving work, get your application for Medicare processed before that so your coverage will start June 1. You're not going to have any gap in coverage. The general enrollment period happens every year. This is for people who have missed their initial or their special enrollment period. It's January, February, March of every single year. You can enroll in Medicare Parts A and or Part B, and your coverage will start the first of the following month. So if you enroll in February, your coverage is going to start March. If you enroll in March, your coverage would start the 1st of April. You may be at a risk for penalties if you are enrolling during the general enrollment period. We do see people every year that are enrolling during this general enrollment period, so it's great that it's available to everybody. But again, you may have lifelong penalties. So if you have any questions about your enrollment period or your timing, just give us a call at 303-441-1546. We're happy to help you review and set up your timing. This slide here is just a review of the different enrollment periods. The IEP initial enrollment period is the 7-month window that surrounds your 65th birthday month. Special enrollment period is for everybody that's continuing to work past the age of 65 or their spouse is working past the age of 65, 20 or more employees. General enrollment period, anybody over the age of 65 who missed the initial or special enrollment period, and that runs January through March every year. And your coverage would start the first of the following month. This is the end of part one. In part two, we will cover original Medicare, the premiums, deductibles, coinsurance, what is covered, what does it cost.